Hi everyone, welcome. My name's Ellen.
Hi, I'm April.
Today we're going to be talking about chronic pain and how this can impact people's lives, where it comes from, how you can test for it, how you can treat it, a whole bunch of things, because it's something that we actually see pretty commonly in the clinic, but people might not have it as their number one symptom as well. So let's start by talking about first off where it can come from then. So one of the first things about chronic pain is that it can come from a wide range of different kinds of places, basically. So the first one that I thought of was physical trauma. So when people actually are in an accident, something happens physically and the pain stems from there. So something that I normally ask people in the clinic is when did this happen, or when have you never felt well since? And that can be a really good way to pinpoint where these kinds of things happen. So another thing that April and I were talking about was emotional trauma, and how that can really stem from it. So whether it was something that had happened in teens or in early 20s, and then that can cause problems later down the track. But then you were talking about the other important thing.
Yeah. So really with pain is just really our body letting us know that there is something wrong. There is an underlying reason that we're experiencing this painful sensation. Now, it's also important, and it is a sensation, it's something that our body's picking up on, that there is an issue. It's a little indicator. So it's really important for us as health practitioners to address pain in its acute phase before it does go on to that chronic stage. Because often what happens is we can deal with the underlying issue for the pain, but if we've let it go too far, your body tends to remember that pain. So when you're under those times of stress, you'll get this trigger and your body will default often back to that pain, even if that underlying issue has been resolved. So that's one thing I'd say. If you're someone out there who has had ongoing pain, the earlier you do something about it, the best results we have for really resolving it long term.
Especially if you aren't someone who wants to go on medications for the chronic pain, because the earlier that you can work on the herbs or the nutrients, the natural treatments that we have, the quicker that it will work and the easier that it will work, rather than waiting for it to become a chronic pain and then for it to taking 6 to 12 months to be able to see changes. So another thing, so we were talking about stress and how that can impact it. Another thing is also looking at what's happening with your gut health, because your gut is what sets up your whole health system, basically, in terms of your good bacteria is what helps to absorb nutrients, is what helps to convert different kinds of amino acids in the body to things that your body can use it for, to be able to help reduce that inflammation pathway. So there are different kinds of tests that we can do to be able to see the inflammation pathways too. So in blood tests, there are markers for inflammation that you can test. But then in terms of treatment, there's a whole bunch of stuff that we can use with specific kinds of pain treatment, but also working on reducing inflammation. What would be your number one thing that you would use, April?
Well, I do really love using herbs. We've got some really beautiful anti-inflammatory herbs, and a simple one that you can include even in like your diet is turmeric. Turmeric is a really powerful antioxidant. So when we talk about inflammation and pain, often the way that we combat that is by using antioxidants. So inflammation, especially chronic inflammation that we see with chronic pain, creates oxidative stress within the body. So it starts damaging our cells from having that ongoing pain. So turmeric and other like herbal anti-inflammatories, your omega-3 fatty acids, they all help with reducing that inflammation and then help with that pain. So we see good results with that.
Yeah, and there's lots of research behind turmeric as well. I would say that would probably that and echinacea, I think, are probably the top 2 researched herbs in herbal medicine with really strong evidence with turmeric and inflammation. So it actually works on reducing inflammation markers in the body. Another chronic pain that I just thought of would be endometriosis too, which you spoke about last week.
Yeah.
So turmeric is something that's really indicated for endometriosis too, because it helps to reduce those inflammation markers that then can cause the pain in the end. So turmeric is amazing.
So the other things as well, like just simple like dietary changes, reducing those inflammatory foods. So yes, we can have like an injury where we've hurt our back or something like that, but by having high sugar diets, having alcohol, having things that are promoting further inflammation, we're compounding that. So the first thing we're going to look at when you come along with pain, yes, we're going to look at, okay, what caused it? But let's look at removing things that are exacerbating, that's adding to and stopping your body from healing.
Exactly.
So removing that. Water intake is really important for the body to be able to remove any toxins, remove any byproducts of damage that's happened.
And I guess it's looking at 2 different people. If 2 different people are in the same situation with the same physical trauma or whatever it might be, is that we need to look at what the difference is, what's going into the body, what's already there in terms of nutrient status as well, is really important for chronic pain situations. But then also trying to look at what the actual cause of it is if we're not sure of it yet. And getting the right treatment plan is important, because chronic pain is something that can affect so many different systems in the body. You know, it can stop people from sleeping, it can cause depression, it can cause hormone imbalances, nutrient deficiencies, hair loss, all of these things that can go along with it. So a lot of people find that when we work on reducing the inflammation and with the herbs and the nutrients, is that it can start to reduce, and you notice those other symptoms that can go along with chronic pain can reduce quite quickly too. So not only are you treating the chronic pain, but we also need to be looking at what else is going on in the body, not just that. Which I find really interesting, and I've had quite good results in clinic by doing it that way, with a few totally different cases, but working on that main pathway is really important. But we do have a lot of different herbs as well, so a lot of the time combining different herbs can work really well. So some other kinds of herbs that work well for pain are things like boswellia, cat's claw,
so ginger, any of your antioxidant, anti-inflammatory herbs.
Yeah, lots of things there.
And it's important to remember as well, pain is a stress on the body. So there's no need, I think sometimes we can say, okay, it's only a little bit, or we can tend to tolerate it until it does get into more of that chronic stage. But it is a stress on the body. Your body's dealing with the effects of that pain all the time. So then we also have to look at supporting neurotransmitter, making sure you've got good neurotransmitter balance, because it will affect your stress levels as well. So dealing with any anxiety that arises from being in chronic pain, and that maybe not being able to work because of it. So we really want to focus on pain management in a holistic way, rather than just taking away the pain. We really need to support the body and what it's experienced. Yeah,
and a lot of people who are dealing with chronic pain may be on a lot of medications for that as well. So the experience that I've had is being able to work with their doctor to be able to help to reduce the symptoms, but also to be able to not be contraindicated with the medications, but also be able to start reducing the medications when they're feeling like they're able to, and when their doctor is giving the okay as well. So that's something that's normally what a lot of people come into the clinic for, is to reduce their medications, because that can also cause other side effects going along with it, like feeling really exhausted, low mood, all of those things that go with medications for pain.
Often weight gain from steroidal, anti-inflammatories, that sort of thing. I see weight gain a lot. So once again, even more reason to deal with the underlying issue instead of just taking something that alleviates it.
Because not only the medications can cause that, but just being sitting around, not doing anything because of pain is what can also cause the weight gain. So it's just a big mind map, and everyone's different. So that's why looking at the person individually and not just having a one-size-fits-all for chronic pain is really important for everyone's case. Yes. Anything else to add?
No.
April? All good. Okay, well, I hope you enjoyed our session. If you have any questions, please just leave a comment below and we'll get back to you. And look forward to seeing you soon. Bye.
Bye.